Hi everyone, welcome back to my YouTube channel. Today we are going to talk about extradural hemorrhages. At the side you can see the diagrammatic representation of different type of brain hemorrhages for reference, and here also you can see extradural hemorrhage for the reference. So let's start the topic with introduction. An extradural hemorrhage is a form of intracranial bleeding that occurs between the inner table of skull and the dura mater, that is the outermost meningeal layer. Although it accounts for a small percentage of head trauma cases, it is a true neurosurgical emergency due to its rapid expansion and brain compressing potential. Anatomical location and pathophysiology. The dura mater in skull is tightly attached to inner surface of cranial bones, especially at sutures. In extradural hemorrhage, bleeding separates the dura from the skull, creating a potential space where blood can accumulate. Most often, the bleeding is arterial in this case, leading to rapid accumulation and elevated intracranial pressure. The classic source is the middle meningeal artery, which runs beneath the pterion, that is a thin and fracture-prone area of the skull. Causes and risk factor. Trauma is a leading cause, especially high velocity injuries like motor vehicles accident, sport injuries, falls, or assaults. Second is temporal bone fracture, particularly that involves squamous part of the temporal bone, commonly disrupt the middle meningeal artery. Third is less common, but extradural hemorrhage may arise from the venous bleeding that may be diploic or dural venous sinuses vein, and it usually is slower in onset. Clinical presentation. Hallmark of extradural hemorrhage is the lucid interval, but this is not always present. Typical symptoms of extradural hemorrhage includes initial loss of consciousness, then transient recovery, that is called as lucid interval, followed by deterioration. Then there may be severe headache, nausea and vomiting, seizure or altered mental status, and focal neurological deficit may be there, like hemiparesis or ipsilateral pupil dilation due to oculomotor nerve compression. Then there may be another symptom that is Cushing trials, that is mostly the late sign. It includes hypertension, bradycardia, and irregular respiration. Radiographic presentation. Imaging modality in non-contrast CT scan is the gold standard for the imaging, and classic findings include a biconvex hyperdense mass, as you can see here in the diagram, that is also called as lens-shaped hyperdense mass. It is located typically in the temporoparietal region, but it can be present in any other region if the veins are involved, and it does not cross the sutural lines due to tight dural adherence, but may cross the midline if large. It may show midline shift, ventricular compression, or herniation signs in severe cases. Management and treatment. Emergency response is to stabilize the airway, breathing, and circulation, that are all called as ABCs of life. Then immediate neurosurgical consultation is done. Then surgical intervention is the second thing, that include craniotomy, that is removal of bone flap to evacuate hematoma. Second, we can do burr hole evacuation that may be performed in emergency setting. Management and treatment further involve medical support, that is manage intracranial pressure with medications like mannitol, hypertonic saline. Monitor neurological signs closely in ICU setting for any deterioration of neurological signs, and reverse coagulability if present there. Prognosis. Excellent prognosis when early intervention is done before brainstem compression. Delayed diagnosis can lead to brainstem herniation and death. Mortality can be reduced with rapid diagnosis and prompt surgical evaluation. Younger patients tend to recover more fully due to better cerebral plasticity and hemodynamic reserve. Now let's talk about differential diagnosis. When evaluating a patient with suspected intracranial bleeding, it is important to distinguish extradural hemorrhage from subdural hemorrhage, that is crescent shape on CT and it is venous origin. Subarachnoid hemorrhage, as you can see here in the diagram, it is diffuse blood in sulci assistance. Suddenly, thunderclap headache is there. Intracerebral hemorrhage within the brain, that is within the brain parenchyma, commonly associated with hypertension. Now let's talk about conclusion of this lecture video. Extradural hemorrhage is a classic neurosurgical emergency, sudden, dangerous, and often deceptive. It is well known as lucid interval offer only a narrow window for intervention. However, with rapid recognition and prompt surgical treatment, patient can make a full recovery. And this was all about extradural hemorrhage. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.